I have been a practicing gynecologist for almost 46 years. And how I went into this, normally you go up the ladder from Ayurvedic to whatever, and you eventually our aim is to get to conventional, that's the top. And everybody wants to know why I have come few steps down to unconventional medicine. In 2005, December, my wife was diagnosed with cancer of the colon, and it was third stage, 3B. She had a growth the size of a tennis ball at the junction of the descending and sigmoid colon. An MRI showed that, and also 6 lymph nodes were involved. Colonoscope confirmed cancer or adenocarcinoma, and 9 inches of the colon was removed with the growth, and all the lymph nodes were also removed. The first 2 were involved, the other 4 were not involved. And having been, I am now 75 years old, I became consultant in 1972 when there were no oncologists. The cancer doctors were merely doing radiation, and they were called radiotherapists. We, the clinicians, were doing the chemotherapy and the surgery. So we adjusted the doses of chemotherapy, and we only referred if radiation was required to the oncologist. The last 25, 26 years, oncologists came in and they took over chemotherapy from us. So we only do the surgery, the chemotherapy was, and the radiation was done by the oncologist. So they sat down and created lots of protocols, and even today, chemotherapy is a bit of a probe in the dark, because what works on me might not work on another. So there was a lot of combination of drugs, and what actually drew my attention was the terminal stages of patients who had chemotherapy and who did not have chemotherapy, or who walked away from chemotherapy. Say if I had referred 10 cases, the 2 bad ones with 1 or 2 chemotherapies, they go off. Of the balance, approximately 50% would go through the entire course of chemotherapy. The other 50% will have lots of problems in between, some after 2, after 4, immune deficiency, muscle weakness, all kinds of issues. Of course, cosmetic doesn't bother very much, and they come back to us. When you got a problem, you call the oncologists, and they would say, this patient I have already given maximum, I cannot give any more. The other one, she can't take any more. The distinct difference between my patients and the other specialties, like if you get a cancer colon, you go and see the surgeon, and probably that's the first time you see a gastroenterologist. But in my case, all my patients are sort of my friends. I've delivered 3 or 4 of them, and the terminal stages was horrifying, and it was a tough decision to make. My daughter is a doctor, she is now in the US, so I sat down and I told her, I am not in favor of chemotherapy. I would rather let my wife go a few years earlier in comfort than to watch the misery of giving the extra few years. I said I didn't have the gall to take that, and we were looking for an alternative, because cancer has got 2 types of spreads. One is the macroscopic spread, which the MRI or CT scan will pick and can be dealt with during surgery. The other spread is called the microscopic spread, which the MRI or CT scan will not pick. This can show up 2 months later, 2 years later, 4 years later, but if does not show up for about 5.5 to 6 years later, we say cancer is in remission. We never use the word cure. And this only happens to stage 1A and B. Here we are dealing with the stage 3. So, and having decided to look for an alternative, this was in 2005 December. In 2006 April, my daughter got married. all my friends all over the world were there, and after the reception, 17 of us sat down, and all of us unanimously agreed, including an oncologist, that we should hold chemotherapy to see what we can find. And it so happened I think it was in 1995 or 96, when we went to the US, for some reason, we decided we should go to Cuba, Havana, basically because Cuba always had American sanctions. Only now I think there is some sign of easing up. And you were so close to America that the sanctions were foolproof. So they were completely out of modern medical development, of medical technology, maybe machines, maybe medications, even instruments. So, but when they came and presented their results, they were comparable. So we just wanted to know how they are achieving this. And almost 50 of us ended up in Havana. And as we were doing some sightseeing, one in the group, he's of Indian origin, practicing in the US citizen, complained of chest pain and difficulty in breathing. The ambulance came and took him, and we were told that he has had a mild heart attack, but stable. And another friend of mine who actually trained him was there, and he said he wants to go and see him. So I joined him. So when there, he was in intensive care, and we could see through the glass. And what actually surprised us was he was not given an oxygen mask or nasal oxygen, which is mandatory even in a suspected heart attack. Here we could see signs of ischemia on the monitor, and still he was not given oxygen. So a friend of mine said maybe we should take him back to the US. I'm not very sure what they are doing here. As we were discussing, the ICU nurse came out, and we said we are doctors, he's good friends. And she said, you want to see? I said, fine, let's go and see what he has got to say about taking him out back to the US. And that was the first time I was exposed to ozone being used in medicine. All they were doing was taking his blood out into a blood donation bag and mixing with ozone gas. And of course, the blood coming out was very darkish. Once ozone was mixed, it became very, very bright red, and they had just take up 250 ml and put back. And he said once they started doing that, he felt comfortable, his pain had disappeared, and his breathing was pretty normal. So it really got us thinking. And what really made us think even harder, the next morning, his ischemic changes in the ECG had totally disappeared. You see, ischemia is a condition caused by lack of oxygen. Blood carries two important things, that is nutrition and oxygen. Heart attack or stroke is caused by either a narrowing or a block in the blood vessel. So if there is a narrowing or a block in the blood vessel, the blood supply is reduced. If the blood supply is reduced, obviously the oxygen supply is reduced. Wherever there is a reduction in oxygen supply, we call that ischemia, and it causes pain. Even in the skeletal muscle, a dog might be chasing me, I keep running. The utilization of oxygen by my muscles are far in excess of what I can replace by breathing. However fast you breathe, you can't compensate the loss of oxygen in your muscles. There will come a stage where you can't bear the pain and you can't breathe anymore faster. So when you stop, your muscles are resting, they are not using oxygen anymore, but your breathing is gradually taking your oxygen level up. When the oxygen is optimized, your pain completely disappears, and you can run the same distance again. The other example of this is labor pains. When the uterus contracts to push the baby out, there is hardly any space for the blood to flow. So slowly the blood supply to the uterine muscle is diminishing, and the oxygen supply is diminishing, and also the nutrition is diminishing. You require both oxygen and nutrition to sustain a contraction because that is a force. So once these are diminished, there is no more power. So the uterine muscle slowly flops. The blood supply resumes. The oxygen supply is restored. And slowly the pain goes away. The nutrition is restored. The oxygen comes to optimal. The hormones bring in the next contraction. Ischemia, if it can be reversed, within 25 to 30 minutes, you get a total recovery. If it is sustained, then we call it infarction, myocardial infarction. Myocardial infarction is transformation of elastic tissue to fibrous tissue. Elastic tissue is functional. It requires much more oxygen. So when you don't provide enough oxygen, and if this level of low oxygen remains, in order to survive, the elastic tissue transforms to fibrous tissue. So this is actually an ischemic patch becoming an infarction. A heart attack or stroke, as I said, is caused by reduction in the blood flow. So a narrowing or a blood clot, we call it coronary thrombosis, a thrombus obstructs. So if 10 ml of blood is flowing, suddenly it's reduced to 6 or 5 ml. Obviously, the oxygen supply is also reduced. Here, the air we breathe has got only 20% oxygen. At the end of expiration, the air passage no longer has oxygen. It's replaced by carbon dioxide. The next inspiration when we take, the air in your air passage goes before the air goes in. So your 20% becomes 15%. Ozone is O3 and oxygen is O2. So ozone actually has 50% more oxygen than oxygen itself. So you are putting in virtually 50% more oxygen or 150% oxygen through ozone. So the reduction in the volume of blood flow is being compensated by the increased concentration of oxygen. Almost 300 times more oxygen is going in because 150% oxygen. Your breathing is only 15 or 16% oxygen. In layman's terms, initially it was 1 cup of coffee with 2 spoons of sugar. The coffee is the blood, the sugar is the oxygen. Now, though the coffee is half a cup, the sugar is more than 2 spoons because of the increased concentration of oxygen. So, what does it matter if the volume is 6 ml? The oxygen concentration is more than before. So, this is how it sort of replenishes or even produces much more oxygen than before the heart attack. Basically, this is a red blood cell, and the surface of the red cell is given, the God gave us this surface. Apparently, you can't have any other shape which has got more surface. It could be a cube, it could be a sphere, but this particular shape, and it is the surface of the red cell that takes oxygen and gives out carbon dioxide. When it reaches a lung, the carbon dioxide is replaced by the oxygen. It goes to the body, gives the carbon dioxide, gives out the oxygen and takes the carbon dioxide. So what toxins does? Today I am completely convinced that all our problems are due to accumulation of toxins and lack of oxygen. Even in our Vedas, they say the essence of life is prana, which means breathing. So, the oxygen to me is the elixir of life. So, the richest source we can find is ozone. And what these toxins does is clusters the red cells together. That side is actually a build-up of the toxins. If you really want to see blood with absolutely no toxins, it is this, blood of a newborn baby. No toxins at all, and some of them have not even got their normal configuration. This is an enlargement. Now, aging is also caused by lack of oxygen and accumulation of toxins. We are all born with 65% elastic tissue and 35% fibrous tissue. Elastic tissue, as I said, is functional, requires more oxygen, no nutrition. As we become more and more sedentary, we don't breathe enough. In order to survive, the elastic tissue gets transformed to fibrous tissue. And this is the whole physiology of aging. Your ligaments get tougher, your muscles get tougher, and babies are so elastic. Very often you hear they are thrown off the first floor, nothing happens. In an accident, they are thrown off and nothing happens because they are so elastic. In anti-aging therapies, you have got your HRT or hormone replacement, for males testosterone, aesthetic, invasive, non-invasive and all that. The natural one, the diet and exercise, of course, is one of the most effective ones, which unfortunately is practiced only by the hardcore poor. Because their way of making a living is with their muscle. They are sweating out and breathing throughout 5-6 hours a day, and therefore they actually burn off the carbohydrates they consume. In food, we have got 3 types: carbohydrates, protein and fat. You can cut a chicken, human being. We see the protein, we see the fat, but we cannot see the carbohydrate. Yet carbohydrate is 70 to 80% of what we consume. So what does where is the carbohydrate? Carbohydrate has got only one function, one and only function, and that is to act as fuel for our muscular activity. So once we consume the carb, we don't burn it with our muscular activity. Where is the carb? We don't see it. So all this carbohydrate, which we don't burn out, gets converted to fat in your liver, and through the blood goes and settles in your body. The fat in the body is no issue. The fat in the blood is what starts sticking to the inner lining and starts the process of occluding the blood vessels. Even today, for everyone who is dying of starvation in the African countries, 6.7% more are dying of overeating in the civilized population. So always I tell them, don't feel sorry for the people who are starving, more are dying of overeating. Ozone and anti-aging. See, this is what we precisely try to do. The inner lining of the blood vessels gets coated with this fat, and once it gets coated, the deeper areas becomes harder and you get plaque formation. So ozone helps to melt away and clean the piping, and that keeps the blood flow smoother. This is a comparison. Your heart beats 70 times a minute, 100,000 times a day. An average human lifespan, if you live to the age of 67, your heart would have beaten 2.5 billion times. For me, it has beaten much more than that. And do we ever imagine, we take our heart for granted, it moves 7,200 liters of blood a day and stops only when we die. And below I have got a comparison, a car and a human being. The engine of the car is the central unit. Here, the heart. There is still a controversy, people still say the brain. Of course, the brain has the cardiovascular center, the respiratory center. But still, in my opinion, I moved out of conventional medicine and I still believe the heart is more important than the brain. And my 2 questions I usually ask is, there are so many who are brain dead and alive. I can't see anybody who is heart dead and alive. So we have to convince ourselves which of this is true. Your car, every 10,000 or 5,000 kilometers, you change your filters, you change your engine oil. Human beings, we never do. Actually, God has created us as a self-servicing machine. And that self-servicing is oxygenation. Then again, that is something only the hardcore poor are practicing. Our basic problem today is we have evolved in the way of making a living, but we have not evolved in the way we eat. Our forefathers, we inherited the consumption of rice from our forefathers, but our forefathers were working in the farm and the field. They used their muscle to make a living, and today we are using our brain to make a living. The downside of this is brain function doesn't consume carbohydrate. And that is why even now they say the people in the West live much longer because the only source of carb is potato, which is probably about 20-30% of what they eat. Whereas we consume 60 to 70 or even 80% rice, and we don't burn it out. Lifespan 10 to 15 years, but nowadays the cars are also becoming more efficient, maybe longer. Human beings, this is Malaysian 60 to 70, but now the last says men live to 75 and women in Malaysia live to 77. I am not sure of the figures in India. Car, whatever part gives problems, you can always replace. For human beings, I put there GHY. God help you. This is oxygen, this is ozone. You can see oxygen has got 2 atoms of oxygen and ozone has got 3. I'll go back to this. This shows that 2 molecules of ozone forms 3 molecules of oxygen. That's when I say you've got 50% more oxygen. When you put these concentrations of oxygen into your body, you reach a stage when you hit 100%. However high oxygen supply you give, your pulse oximeter in any patient will not show more than 97 or 98. But you never hit that 100%, which happens only with ozone therapy. When you hit 100%, you can't have any more oxygen. There is still 1 atom of oxygen from the ozone that is free. Nothing can remain as an atom. It has to combine with something, otherwise it becomes a bomb. Instantly, it has to fuse with another atom to form a molecule. What we have in abundance in the body is nitrogen. Our waste products are all nitrogen. And nitrogen is N. And when you combine nitrogen with 1 oxygen, it becomes nitric oxide. Nitric oxide is a known potent dilator of the blood vessels. It opens up your blood vessels. Heart patients, whenever they have pain, they are given tablets to keep under the tongue. It's glycerin trinitrate, and the active reagent is nitric oxide. So not only is your oxygen concentration increased by about 300%, but the nitric oxide opens up these tiny blood vessels. So the tissue gets much more oxygen. The next step is, alright, you have got a saturation of nitric oxide. You cannot have any more. What else have we got abundance in the body? Water. Water is H2O, and when you put in the other atom from ozone, it becomes a compound called hydrogen peroxide. Hydrogen peroxide from days immemorial has been used for cleaning wounds. Even in the army, whenever there is a slash wound or any wound, they put hydrogen peroxide, pack it and send the soldier to the nearest hospital. Even after 1 or 2 days, when the soldier arrives, you see the wound will be clean. It's because of the oxygen. Oxygen has got few functions. One is cancer cannot thrive in a high oxygen environment. This has been established many years ago. When oxygen concentration hits 100%, it is totally bactericidal. Even if we are put in a chamber with 100% oxygen, we will stop breathing. So all living organisms, bacteria, virus, parasite, protozoa, they all eliminated with oxygen. And hydrogen peroxide has got a very peculiar property. On normal tissue, it remains hydrogen peroxide. But when it hits necrotic tissue and ulcer anywhere, it breaks down to oxygen and water. So cancer is necrotic tissue. Anywhere you have an ulcer. So it actually increases your healing, one by killing the bacteria and promoting more oxygen for the healing process. And this oxygenation itself stimulates your immune system. Immune system is basically meant to defend your illnesses and improve your repair mechanism. What is the repair mechanism? Is actually our stem cells. That is the most important part of the immune system. What are stem cells? The more you read about stem cells, you get confused. In a very simple form, stem cell is a multi-purpose spare part. And we call it embryonic because the fusion of the sperm and the ovum creates 8-cell blastocysts. These 8 cells can differentiate and form your heart, your liver, your pancreas, your brain, your bone and all that. We all have stem cells in our body produced by the immune system. As we grow older and older, this stem cell population becomes much less. When you put so much of oxygen inside and stimulate your immune system, it is proven that 20 to 25% increase in your stem cells. So, say supposing you scratch your nose, your nasal mucosa bleeds. This stem cell sticks there and becomes a nasal mucosal cell. If you get a gastric ulcer, these stem cells sticks there and becomes a gastric cell. A kidney stone coming down makes an abrasion in your kidney, it becomes a kidney cell. So, this repair mechanism is enhanced. The other thing the immune system produces is an anti-tumor enzyme, and most of these anti-tumor enzymes are increased with the immune system. So, these two repair mechanisms are increased with oxygenation. What does ozone really do? It retards your aging process. As I said, the aging is due to lack of oxygen. Kills bacteria and viruses. In fact, ozone is the only therapy for HIV. But unfortunately, we are not given money to do trials because the retroviral drugs are making billions for companies, and not only for companies but also for NGOs. It oxidizes the toxins in the body, prevents and to some extent reverses degenerative diseases. It's amazing in diabetes, in hypertension, in rheumatoid arthritis. Most of these are due to lack of oxygen. Prevents the propagation of cancer cells and potentiates the effect of chemotherapy. Chemotherapy is carried through the blood. When a tumor forms, it first constricts, it presses on the blood vessels. So, the initial reaction for a vascularization of the tumor is the blood supply to the tumor is much less than the normal tissue. So, the chemotherapy actually hits more the normal tissue than the tumor itself. Once you provide ozone, what happens is the oxygen, the nitric oxide opens up the blood vessels and more chemotherapy is exposed to the tumor site. So, this is how it potentiates the effect of chemotherapy. Improves brain, it improves all the functions of your body because the blood supply is increased, and of course, the main thing, stimulates your immune system. How do we become oxygen deficient? Most of our toxins, the medicines we take, in 2008, 8.7% of Americans were dying of toxicity of the medications they were taking. And these toxins, as I said, clusters your red cells together. Increased sedentary lifestyle, pesticides in the vegetables and fruit. Pesticides not only the vegetable, whatever pesticide they put, the rain washes it, it goes to the groundwater and it comes along with the water. Heavy metal toxins, the batteries, nickel, cadmium gets thrown, goes inside, explodes, it gets into the water. And a chicken in Malaysia, from the day it hatches, on the 38th day, it is 2.5 to 3 kilos. That kind of growth, it's very difficult to imagine. And just for comparison, we took a 15-day-old normal chicken to match it with a 15-day-old poultry chicken, and it was about 3 times the size. It looked as though it was a different generation. I don't know how it is here. The impurities, the water we drink, and particularly now 147 countries have moved to ozone for water purification. Chlorine kills the bacteria, it cleans. The only problem with chlorine is when chlorine is heated to a temperature of 100 degrees, which is required to boil your water, to cook your food or to make your coffee or your tea, chlorine becomes trichloroethylene, which is a known carcinogen. That's why during the days when you took water from the well and the lake, the incidence of cancer was much, much less. When we got tapped water purified by chlorine, the incidence of cancer rose. Air pollution, till 10-15 years ago, all our fuel was leaded. So those who lived closer to the highways had lead poisoning. Toxins produced by medicines have to. Stress in itself causes, adrenaline causes toxins by oxidation. And as we say, more affluent we get, the more money we want to make, the more stress we get. How do you bring toxins out? Breathing, you bring your carbon dioxide out. Defecation, there are two types of toxins in the body. One is a fat-soluble toxin and the other is a water-soluble toxin. Fat-soluble toxins are all oxidized in the liver. Through the bile duct, they come to the intestines and comes down with the feces. Water-soluble toxins are oxidized in the kidney and comes down with the urine. Salivation again, 30 to 40% of the air we breathe goes through the mouth. So there are a lot of toxins trapped in the mouth. The people who work in the farm and the fields, they chew betel nut, tobacco, they keep spitting. In fact, spitting is healthy because they don't swallow the toxins. But it's considered uncivilized or whatever in the civilized world. Sweating, of course, brings the toxins down. What does these do? The lack of oxygen and accumulation, depression, fatigue, irritability, memory loss, respiration, problems, circulatory, you just name it, it's all there. Now, what are the ways we can administer ozone? Intravenous, direct, and we were surprised in Havana in Cuba, they could reverse gangrene and there is no amputation for gangrene. And they are so courageous, they virtually inject ozone gas directly into the femoral artery. And when we tell them that here we put the foot in hyperbaric chamber, they say when the skin is dead, how much oxygen does really get to the affected areas? Intra-articular, they inject ozone for arthritis, intravaginal, intrarectal. And what we do is Eboo, we call it, extracorporeal blood oxygenation and ozonization. That's the color of the blood coming out is darkish, going back is bright. This is the method I was telling you where you take the blood in a blood donation bag and put it back, start. Now, this is actually, he's my guru, he's a Cuban, and he has done a lot of research with ozone, and he wanted to see the effect of ozone on the blood vessels. Each cell in the body gets blood supply. Wherever you prick, you bleed. So it's a micro capillaries who actually give oxygen and take carbon dioxide, not the bigger vessels. An adult human being has got 30,000 miles of blood vessels. So here he says it improves vasodilatation, of course the nitric oxide, reduces, hypoxia is low oxygen. So reduces low oxygen means increases oxygen. He took an electron microscopic picture of the back of the hand, and after 3 months of ozonization, he repeated it, and he found new microcapillaries. He was very aesthetic, and he called me and he said, this is what I found, and he even called it neoangiogenesis. Neo in medicine means something new. He was so aesthetic, I didn't want to dampen his enthusiasm. A few days later, I called him, I said, I am an obstetrician. I know how a fetus is formed. And as I told him, everything is formed at birth. It only becomes bigger. You don't get new microcapillaries in an adult human being. So he said, what should I do? I said, think, you know what's happening in the beginning, you know what's happening in the end. So you just find out what happens, what the process of how it happens. And so he did that, and what he found was the pen. Just there's one. Assume this is a microcapillary. The blood is flowing from this side to that side. The blood flowing in a blood vessel doesn't flow like a blood in a tap. There the pressure is constant. Here we have got two pressures, systolic and diastolic, when the heart contracts and when the heart relaxes. So it goes in waves. Toxins clusters the red cells. So they become a clot and they obstruct the inlet. When they obstruct the inlet, this whole microcapillary collapses. A space becomes a potential space. It's like a balloon without any air. So it flattens out. So ozonization has actually oxidized the toxins, disseminated the clot, the nitric oxide has opened up the blood vessels and blood has started flowing again. So a capillary that had collapsed has suddenly started functioning again. I had an amazing result with ozone. I was using reading glasses for 19 years. 4 years ago I discovered I don't need glasses anymore. And that was also by accident because I was sitting, a cancer patient was there with the biopsy report. I dropped my glasses. So I asked my nurse from the gynae clinic to bring my glasses. And she was there with the glasses and I read it. I asked many ophthalmologists, none of them could give me an answer. But this gave me the answer. You see, vision is basically basic physics, your lens and your mirror. The mirror here is the retina. If the retina moves backwards, you get hypermetropia or reading glasses. If the retina is swollen or gets bigger, some disease, then you get your myopia, astigmatism. How does the retina move backwards when your skull doesn't grow after you are 45 or 50? So what actually has been happening is, these microcapillaries, the retina is a very vascular organ. In fact, by looking at the retina, you can diagnose blood pressure, diabetes, various diseases by the stage of the microcapillaries. So gradually these microcapillaries has been shutting down and the retina has become thinner and thinner. Over repeated ozonization over the years, the retina has come back to its normal position. So all our organs will function much, much better with this process of increasing blood supply to the organ. This is precisely what we try to do, is to clear up the muck in the blood vessels. I was only doing cancer treatment from 2006 till this patient came around. He had a heart attack on the 1st of February 2009. He went to a heart institute in Kuala Lumpur. They did an angiogram and told him that he has got 3 blocks, 90% blocks, and he needed an immediate bypass. His mother believes in astrology, so they went to see the astrologer. The astrologer said, your time is bad, hold for 6 or 7 months, otherwise things might not be good. And he also said, he came to see me a few times with problems. He said, you can go to Melaka and see Dr. Mahendran. If you believe in what he says, you can give it a try. So he came to see me, and this was his blood picture. As you can see, you can hardly see a single cell. So I told him, if you want to wait, why don't you give me a chance? And I also know chelation has been used by Dr. Crenton for a long time to open up blood vessels. He, being in America, could never integrate both together, and here it was an opportunity. So I went and told him, I want to create a protocol, and I was prepared to treat him free just to see the outcome of this. But his mother said, no, if you don't pay for your treatment, it doesn't work. So we created a protocol where you give 3 or 4 ozones first. The reason being, say, when you do an Eboo on a patient, we can get 500 ml. We can even get up to 200 ml of toxins coming out. Our blood volume for a normal adult is about 5 to 6 liters. If you take 2 liters out of the 6 liters, we are dead. So what replaces these 2 liters? It's the toxins from the body comes into the blood and then the machine removes it. If the machine is not there, your kidney and your liver has to remove it. So in a very simplified form, your body is the house, the blood is the dustbin, the removal areas are your kidney and your liver. If your dustbin is full, how can the body empty the toxins? So the purpose of putting on the machine is to empty the dustbin first, so that toxin can keep coming out. Then I give them 5 chelation. I'll tell what chelation is once I finish this. Then I go back to ozone. So this was on the 4th of February when he came. This was before and after. Then he had a course of 10, 5 chelations ozone, 5 chelations ozone. End of March, this was his blood picture before doing and after doing. He had 35 chelations, 5, 5, 5 with a few ozones in between. This is the end of the treatment, 5th of August, before and after. And he went back again, they did an angiogram and they said 50 to 60% of your blocks have cleared, you don't need a bypass. That was my first success story, and we have done about 17 or 18 till now, clearing the blocks and avoiding bypasses. This oxygen and ozone after the treatment remains in your body for 48 hours. It's only after 48 hours it comes to the baseline. We had known the theory of this for a long, long time. This was a gentleman, mid-30s, a high executive of a pest control company, and he had complained of aches and pains. The company had sent him to all the specialists, and they all said there's nothing wrong, and they were about to refer him to a psychiatrist. So he came to see me. I said, looking at your blood, it looks good, but your history of pesticide might be some toxin. You want to give it a try? He said, fine. And this was before doing, this was after doing. Exactly 48 hours later, he called me and he said his pain is so excruciating and he had never experienced that kind of a pain before. So I said, why don't you come? He said, I can't even drive. So he got his brother to drive me, and I was stunned when I saw his blood picture. So he has had so much of toxins in the body, the moment you emptied it, they just gushed out. And that particular day and the next day, I had slaughtered, I couldn't fit him in because we have got 4 machines, Naveen knows, and we can do only 16. So I told him, you have to come back again. The only thing I could think of was we gave him an intravenous drip, about 4 or 5 liters of dextrosaline so that he could pass urine and get the toxins away. So when he came back on the 4th, this was his blood picture, which has improved a lot, but it is worse than when he came first. So on a cursory look, we cannot judge to say how good the person is, because only as you dig, you get results coming. This is before doing, after doing. He used to come and do for a week, and then he is becoming regularly. Once you wash the inner soft layer of the, you can see that is actually a blood vessel, and that is the plugs that stick on. Why is it diabetics are more prone to vascular diseases is because it's not the glucose. When you have a spike of glucose, you need sugar going up, you have a spike of insulin. Insulin is a little corrosive, and so it starts, I don't have a pointer here. So the insulin actually damages the endothelium and it starts a bleed. Wherever there is a bleed, the process of stopping the bleed is clotting, is stopped by a process of clotting. This clotting is started by a platelet factor, and again, whenever there is a rough surface, that keeps going bigger and bigger. And when it goes to that size, this area has got no blood supply. It only gets oxygen from the blood that's flowing in the blood vessel. So since there is not enough oxygen to sustain as a clot, it gets calcified or soft stone, and that is what is called plaque. This soft stone, once you clear this with ozone, after 3 or 4 ozones, you will see this plaque breaking up and coming in. It appears as this, and we call them crystals, though you can't use it to make jewelry. And usually it's cholesterol, uric acid, whatever, the hard stuff, plaque breaks and comes out like this. If this is in 1 drop of blood, how much is going through the blood vessels? This is a blood picture of Dr. Amin, who works for Dr. Suresh. This was before ozone and that's after ozone. So as you can see, the whole purpose of this treatment is to oxygenize . It increases the amount of available oxygen 300 times. Assume that this is one red cell. It's a surface, oxygen goes, carbon dioxide comes out, carbon dioxide goes, oxygen comes out. There are 50 pages here. If the 50 pages are stuck together by toxins, how much oxygen can this carry? So if the toxins are removed with ozone, it can carry virtually 50 means 100 surfaces. So the transport mechanism increases by hundreds or even thousands of times. The other one is all the organs perform in accordance to the availability of oxygen. So all your organs perform 200, 300 times more than normal. And the downside of biochemistry is your liver or your kidney function will only show in your biochemical tests after 60% of your liver or kidney has failed. They are such efficient organs. So it increases the amount of available oxygen, improves and enhances the ability to transport oxygen, and improves the performance of all your organs. If you have got an artery disease, coronary artery, you do a bypass. It solves the problem of the coronary artery, but very logical to assume that if your coronary arteries are blocked or diseased, the arteries all over the body are diseased. Your kidney, your liver, your muscle, your brain. So this will only repair your coronaries. The others, it doesn't. With this treatment, you clear your blood vessels and all your organs begin to function better. Can you see how much oxygen can this blood carry? Hardly any. And look at the difference after a 1 hour treatment. This doesn't happen to everybody.
How long does it stay?
1 hour.
After the treatment?
Yes, after treatment.
It stays organized like
No, no, it doesn't stay organized like that. It comes out first, and depending on how many sessions you have had. Initially when you do that, when you come back the next time, you go back to square one or even worse. Because any dirt, when you dig, only then it's coming back.
Are the effects cumulative?
Yeah, the effects are all caused by the toxins. So as you keep removing, this is something that has been built over 10, 15, 20, 30 years depending on our age. So we can't just do it in 1 or 2 sessions.
No, I understand. I'm saying the number of treatments
Yeah,
one would undergo,
yeah.
they are all cumulative in nature. Can
Yes,
you-
yes, yes, yeah, it is.
It depends upon your lifestyle.
Yeah, lifestyle, toxins.
It will come. I've been going back to
You see, Naveen, I don't accept patients who have heart problems who smoke. He is only exception. Because there's a conflict in interest. I try to keep my life, he wants to commit suicide. This I'm showing you just a blood picture. I delivered a baby around 6:30 in the evening, and the father seemed a little upset. All was well, it was a boy, Chinese gentleman. So I was worried something happened in the ward or the department. So I asked him, what's your problem? He said, no, nothing here. My father has had a heart attack, 57 years old, diabetes and hypertension. So he knew I was doing this and he asked me, will this help? I said, no, this is not the right time. Let him recover, do an angiogram, let's see the blocks and start. And I have never seen anything as bad as this. He insisted. I went to the CCU, took a drop of blood and went back, you know. And when I went for my rounds the next morning, he said he passed away. This is a patient who had chemotherapy. And chemotherapy is so toxic that even on the machine for 1 hour couldn't cope with the toxin that was coming out. This is after. Now, this is our problem. Our biggest enemy here are the pharmaceutical companies. They don't want therapies that cure, they only want therapies that treat symptoms. So, it's a fight, the fight is still going on. Now Europe has completely opened up, Canada has opened up, but the FDA in the US is still holding on, but I don't know how long they would be. And the other problem is, for FDA approval, you require a double-blind trial. A double-blind trial means we pick, let's say, treating baldness. You take 100 people who are bald. 50 are given the real medicine, 50 are given a placebo which looks like the same medicine. The patient doesn't know, the doctor doesn't know. It's all coded. And after 1 year, they see if the 50 on the medication, 50% had improvement. The 50 on the placebo, only 15 or 20%, this is approved. Which cancer patient or patient with a heart block will be on a placebo for 1 year? How do we provide double-blind trials? Safety of ozone. If done properly, it's 0.0007%. What problems can oxygen cause? Only in excess it can cause problems. So, the safety is, they say it's as good as taking a tablet of aspirin. This is the other thing. Ozone is available in the atmosphere, so it cannot be patented. So, nobody can make money with ozone.
You said it's oxygen.
Yeah.
Nothing.
Yes.
But isn't the fundamental way this therapy works is by taking out the singlet oxygen?
No.
You have O3.
O3.
There's oxygen.
The first process is 2 molecules of ozone becomes 3 molecules of oxygen. Subsequently, when you've got saturation of oxygen, the third atom of oxygen becomes nitric oxide. Then the third atom of oxygen becomes hydrogen peroxide. So there's no way you can have anything more than 100%.
So are you suggesting that there is peroxidation?
Of course, there's oxidation. You need oxygen for your toxins.
Peroxidation.
Peroxidation. No, peroxidation is something that is created by incomplete atoms. An atom has got electron, proton and neutron. So anything that lacks sticks on to the cell wall. That is peroxidation. This is very different from oxidation.
Right. No, I was talking about peroxidation.
Yeah.
Finally, the body fights, say, cancer
Yeah.
by its own internal process of peroxidation.
Yeah.
It's been proven.
Yeah.
But I was wondering what this ozone does here.
The ozone does by increasing the cancer cannot thrive in a high oxygen environment.
That is very good.
Precisely. That has been proven many years ago. See, this is the Eboo process basically. Your blood your blood enters here and goes into this filter, dialyzer, whatever you want to call. Goes up and comes out. Medical ozone is medical oxygen is converted to ozone, and I think this is, I'd rather do it myself. Blood enters here, goes up this cylinder or dialyzer, gets out from there. So, the blue tube up there is through which ozone, medical oxygen is converted to ozone and comes in. We given enough ozone here to saturate this particular volume of blood. So, this is where the oxidation of your toxins takes place. When oxidation of fat soluble toxins and water soluble toxins, normally whenever this happens, oil goes up, and there is a diaphragm just before the exit, which is 0.002 microns, that does not allow the fat to go past into the inlet. So, all the fat soluble toxins go up and the water soluble comes down through this tube, and that is the one that brings out your 1 or 2 liters of water soluble toxins. The blood minus the toxins goes through the outlet, and you can see the color difference between the blood going in. This is the basic mechanics of Eboo. I just put that up. Why is it not moving? Padma? That's the fat that comes out. Can you see the yellow? That's the fat that comes out in the outline, which is filtered off and it's not there when it goes in. Go to chelation. Chelation actually was done for heavy metal poisoning many years ago. We had lots of our pipes all made of lead, and paint contained a lot of lead. All our fuel was leaded, so lead poisoning was very common, and EDTA was used to remove heavy metal poisoning from the body. And then we've transformed to copper pipes and PVC pipes. The lead content in the fuel came down, the lead content in the paint came down, and we did not have heavy metal poisoning. Subsequently, again heavy metal poisoning came back 15 years later, and this was the mercury alum which dentists started using for the filling. So again EDTA came in to remove this heavy metal poisoning. Dr. Creighton took a piece of the pluck, the crystals as I showed, the arrow is there, and he found out that it was not the calcium, but it was the heavy metal that was binding the calcium together. When we talk of heavy metal, we think, iron, nail, copper, pipe. But the metal we have in our body is all in liquid colloidal form. So, liquid colloidal heavy metal becomes solid and binds this flux. So, we have to liquefy it to bring it out of the system. And that is when we started doing EDTA to chelate this. And 1990, I think, is when they discovered nanobacteria. Nanobacteria, as the name sounds, is very small. A normal microscope doesn't pick it up. And I think the people who found nanobacterium in 1990 were awarded the Nobel Prize. I can't get the name. And they are very slow multiplying nanobacteria. And what they normally do is they form a shell, a calcified shell, and stick to the inner linings of the arterial wall. This creates a rough surface and initiates a process of clotting around it. And no antibiotics can work on it. Even ozone does not kill this. So the only way you have is to use chelation to expose the nanobacteria and then use calcium, ozone to kill the bacteria. And this was one of the causes of heart diseases, particularly when it's familial. If the whole family is exposed to this bacteria, then the whole family, father, mother, grandfather, they start getting it. And that is what we went into chelation. Chelation therapy has been there for many, many years, as I said, and it was a coincidence that they found how it worked for heart disease. Someone who has had heavy metal poisoning, who also had coronary artery disease, went to clear the heavy metal, and eventually the coronary artery disease was also cleared. So that is when Dr. Creighton went into further research to get from a post-mortem plaque and found that it was a heavy metal that was binding it. So EDTA is actually non-surgical treatment for heart disease and atherosclerosis. Atherosclerosis simply means hardening or narrowing of your blood vessels. And blood pressure is usually caused, hypertension or primary hypertension is caused by hardening of your blood vessels. This is textbook of EDTA, and he has now written a book, How to Bypass Surgery with EDTA. And now we have brought it down with our additives to about 1.5 hours. It's a simple intravenous drip. Patient walks in, administered safely by nurses, but I would think there should be a doctor standing by. His pictures are all 45 years old. I am still holding it, black and white. You can sit down, watch TV. And disease treated, coronary heart disease, brain. Wherever there is narrowing or hardening of your blood vessels, it can be treated with EDTA. This is what EDTA is, ethylene diamine tetraacetic acid. Mechanism of benefits uncertain. It binds with metals and is rapidly excreted in the urine. So when metals are coming out, your heart blocks your blood supply is getting better, the blood vessels caliber is more. So chelation of only toxic metals does not explain the full benefit. That means there are also other metals that comes out with chelation. Manganese 132 times baseline, it's all cobalt. All published studies show benefit, though the mechanics is uncertain. We are not worried how it works, as long as we know it works. And there is evidence, and I'll show you how it really works. Dr. Creighton he's now 84 years old. I only caught up with him about 4 years ago, and he was amazed how I managed to clear a coronary artery in 7 months with ozone, which he takes 2.5 years. My advantage here was I could use ozone to clear the backlog where he could not do. So whatever he brought out he chelated and brought out into the blood system had to be removed by your kidneys. And that is why it took such a long time. And this is why before you do chelation, we must always ensure that the renal function or the kidney function is normal.
The chelation takes the good metals away also, isn't it?
Yes, but we replace them in the dosage we give, like magnesium, sulfate,
Put it
in the drip itself.
solution itself.
Yeah.
Okay.
This is all figures, combined figures. I won't bore you with that. I'll just go to the proof how it works. You see, a blood supply, as I told you, in a blood vessel is not as same as a pipe. We have got two pressures, systolic, diastolic. So it goes in waves, goes up and comes down. And if there is an obstruction, when the blood vessel narrows, obviously the pressure can't come down. A 2-inch pipe becoming a 1/2 inch pipe or 1-inch pipe, the pressure has to build up. So if it is abnormal, the pressure remains there. If it is extreme, it stays up. And that is, the extreme abnormality is what usually causes a stroke. And the coronary artery is so small, the moment it comes out of the aorta, it gets into the heart. So you cannot do blood flow studies of the coronary artery. But fortunately for us, the carotids which go to the brain are in the neck. So you can do blood flow studies in the carotid artery. This is a real-time recording of the right and left carotid arteries. This is a patient, 55 years old, before chelation therapy. As you see the left side of the brain, the spike there, that is where the stroke occurred. And for some reason, 8 out of 10 get the lesion on the left side of the brain and the paralysis on the right side of the body because the nerves cross. Can you see the difference between the left and the before chelation and after chelation? This is a 72-year-old before chelation and after chelation. 62 before and after, 57 before and after, 66. This is amazing. A 92-year-old male, look at the difference.
So, can you go back to the previous one?
Yeah.
How are you interpreting this to be beneficial? I don't see.
You see, it's the pressure of the blood vessel that sustains the okay. The normal one, it has to come down. Abnormal stays up because it narrows.
That's pressure, is it?
Pressure.
So the y-axis is pressure.
Yes.
What is x-axis?
You see, I know what you mean by X and Y. This is a normal curve which I see on the left hand side. On the right hand side, the normal is there, that's A, B and C. Okay. The abnormal is when there is a narrowing or a clot where the pressure does not come down. And the extreme abnormality is there. After treatment, you see the abnormality becoming normal. It comes down.
Before treatment, after treatment.
This is after treatment. Sorry. Yeah. Yeah. Normal is, this is more like normal than that. Yeah. The curve is, that's what I say, the pressure in an artery is very different from a pipe. There's two pressures, systolic when the heart contracts, diastolic when the heart relaxes. So it goes in waves. So that's abnormality and narrowing, it can't come down because the pressure is sustained by the narrowing. Once you clear the narrowing, then it comes out. So that's the proof of the treatment. Published study on animals that after just 10 chelations, the animals lived 50% more than those without chelation. Just chelation alone, and probably animals are more exposed to heavy metal, I am not too sure. So now Dr. Crenton, what he does his chelation, and if it's urgent, he sends them to Mexico to do the ozone and come back. So,
for patients who have cardiovascular issues.
No, even normal people can have chelation. That's what he says. If normal people have, get your backlog out with ozone with intermittent chelation, and once you do about 20 to 25 chelations, you carry on doing 1 chelation and 1 ozone a month, he virtually guarantees you won't die of a stroke or a heart attack.
So your
It's a prevention.
therapy is both of them combined
Yes.
at the same time, 2 days.
Not the same day. I usually do them. My regime would be a few ozones, then 5 chelations, then ozones again. The idea is to get the backlog out so that chelation will have space to bring it out.
One of the qualifiers for chelation is that your kidney function
Should be normal. Even if it is partly compromised, we can reduce the doses and give it over a longer. The EDTA short life is about 1 to 2 hours, so you can extend it. Short clear doses. And the other thing I normally do for these kind of cases, give them 1 chelation and give them ozone the next day, alternate. So that way we reduce the load on the kidney.
blocks are gradually reduced. Is it visible when you do a CT angio?
Yeah.
Yeah?
Yeah.
I mean, before and after?
Of course, we have
Not
got
in one treatment.
not in one
Oh,
patient.
but, you know,
Yeah.
set
Over
up
a few
10
No,
years.
I have got 19 patients
Hmm.
who have got 70%, 80% blocks.
Hmm.
After combined treatment, 60 to 70%. You see, all of us have got heart blocks, blocks. Only when it is 85 or 90% you get symptoms. In fact, there's an interesting study in Vietnam when they accidentally sent a cardiothoracic surgeon to the front. So all he did was post-mortem cases he was checking, and he found out that between the age of 35 and 45, 72% had some percentage of block in the hearts. So everybody has. So what you do for prevention when you do this, it doesn't build up to 85 or 90%.
Right. And the other thing Ram was asking about how it helps the diabetes patients.
Yeah. You see, all diabetic patients, they say diabetes affects all your organs because your blood supply to these organs are compromised by narrowing of your blood vessels. So, even diabetics who are on insulin, when you boost your pancreas, your control becomes much easier. And especially when you get insulin resistant diabetes, this will certainly help to rejuvenate whatever cells of the pancreas that secretes your own insulin.
And when you dose yourself with insulin, then the body doesn't have control of that.
Yeah,
And that's when the endothelium you mentioned gets.
that's right.
That's what starts the.
Yeah, it's the insulin spike that damages endothelium. That is why we always tell them, don't take refined carbohydrates, rice, sugar and all that. It gets absorbed, there's a sudden spike, whereas if you take other carbs like oats and things like that, the rise is very gradual. Low glycemic index carbohydrate, the rise is very, very gradual. But rice, sugar, these sweets, they put your insulin so high, your sugar so high, that there has to be a spike of insulin, and that spike is what damages the blood vessels.
Doc, I have, while Googling this 3-4 years ago,
Yeah.
Chelation and this thing, FDA is not permitted in the US. And I
Is
saw
it?
several articles
Yeah.
saying that they gave chelation to 30 people and they gave no chelation to 30 people, and there was no change after treatment. I don't know how old these articles are, because similar articles.
No, on what was it, an angiogram, that's what I wanted.
Yeah, I don't know that. Second thing is, one guy warned, be careful, don't touch ozone because of blood clotting. Then I read an article, you put heparin so that the blood doesn't clot.
We always use heparin.
Yeah.
You see, what they normally do,
Does the what you call quantity of heparin matter, or does it differ from patient?
what actually happens is only 5 to 6% of ozone therapies are using Eboo.
It's just
The rest of them are all using major autochemotherapy, that is bleeding into the blood donation bag, putting ozone and putting it back. The high oxygen level is, you have achieved that. The bactericidal effect also has been achieved. The virucidal effect also has been achieved. The oxidation of toxins also have been achieved. The downside is you are oxidizing the toxins and putting it back again, which is going to throw a burden on your liver and your kidneys. So a blood donation bag has got anticoagulant inside. So the first time there is anticoagulant. The next time you have to run it with heparinated saline or something. Otherwise even the bloodline gets clotted. So we put a 3-way tap, we do that. Those people who don't use heparinated saline, obviously when they put back, the blood clots. So this is why, ozone therapy, there is no rule that only doctors should do. So every Tom, Dick and Harry is doing this, and that is where the complication comes about.
When you explain the difference between the Eboo and the regular auto.
Yeah, Eboo is getting your blood out, removing the toxins
Advantage.
and putting the blood back with 300 times more oxygen and the toxins removed. Whereas autohemotherapy, we put oxygen inside, of course the bactericidal effect is also achieved, virucidal effect.
That is taken out of the body
Yeah.
and then
Put back with ozone,
with ozone.
without removing the toxins.
And this is Eboo is a continuous process.
Yeah.
The end of the 1 hour, 1.5 period,
Yeah.
you can see the toxins anywhere from
Yeah.
100 milliliters to 2 liters.
You see,
depending on
what
the toxins you have.
led to me is when I got my wife's results, I was desperate. I did not want to give chemotherapy. And when I came out of University Hospital in Colombo, a good friend of mine, a very, very well respected academician, asked me what I was going to do. I said, I'm going to Germany to try out ozone. And he told me, somebody with your academic credentials, I can't believe you're going to get involved with quackery. So I kept it quiet for 2.5 years. I gave my wife 2.5 to 3 years. Fine, everything was fine, I was doing well. Only then I spoke out and said it works. And the other amazing thing, as I said, 19 years of glasses and today I read without glasses. I operate without glasses. I'm 75, till I fell down, I've been playing tennis 3 times a week for 2 hours. And she didn't die of cancer, she died of a viral pneumonia.
So, Doc, this is available in Canada now, Eboo?
Yes, no, Eboo no, still major autohemotherapy only.
Major autotherapy.
And Eboo was first done in Malaysia,
Yeah.
then in Japan and Italy. Because for me, when we came back, just to do 250 ml twice, so I tried doing 500 ml, put back. My wife had severe, rigors, temperature and all that. So the only way we could was give her some dextrosaline and pass urine and bring it out. Then only we sat down and thought there should be some way we should be able to get the toxins out.
How old is Eboo? 5 years?
Ever since I started, about 6 years.
Is that an acronym or is that a word? Yeah, Eboo is.
Eboo extracorporeal blood ozonization and oxygenation.
And where did it start?
It's Malaysia.
Malaysia. Malaysia.
I
That's a lot
started-
of, even the machines. Now the machines
Yes.
are made in Canada, right?
Canada and Germany. The German ones are still pretty pricey, but the Canada ones are quite okay.
And also Ukraine, Russia, they all make.
Yes, Ukraine, Russia and all made. I had to devise this particular machine because the GD family had a problem and now they got a machine. And we normally don't allow more than 2.5 liters or so an hour. And this is one of the younger generation GD. The boys was taking a flight and so he came and told the doctor, you put it in 5 and give me half the time. So fortunately the doctor rang me up because that level of ozone and oxygen will hemolyze the red cells and he would die. So after that I don't feel comfortable setting up machines anywhere. So I asked Longevity and we tried this machine.
It is the supplier.
Yeah, where you can fix the flow to 1/8 or 1/4 and that way I can sit comfortably. I mean, in engineering you probably increase the rate to double and cut off the time half, it works, but not in medicine.
Doc, what are the side effects in your last 8 years experience?
Side effects per se with ozone, like someone who has got, say, 50 kilos would be next to a guy who is 110 kilos and he'll say, why is he having 1.5 hours and why am I having 45 minutes? They feel the more time you give, the better they get. So I tell them, no, you can't have more oxygen, you will have breathing problems. If they insist, of course, we get to stand by till they feel breathless, then we knock it off. So as long it is regulated and, done properly by a doctor, the other thing we find is, of course, after doing, they go back. The toxins keeps coming out for 48 hours. And these toxins can cause some rigors, fever and things like that. So we just ask them drink a lot of water, and the next time they come after Eboo, we run in normal saline or dextrosaline so that they pass it out before they go. And of course, the third complication is some of the toxins had been in there for 7-8 years. So it comes out, it can develop some kind of allergy, rash and things like that, which you give them a hydrocort dose, and it can be identified. And of course, the biggest or the most dangerous complication is, as I told you, nitric oxide opens up the blood vessels. And there are 3 factors that maintain blood pressure: your blood volume, your cardiac output and peripheral resistance. Because this is a microscopic network of capillaries, they hold the blood pressure. If nitric oxide opens them up, your blood BP can fall. So we always have ephedrine or adrenaline to counter that. That is why somebody is sitting there beside you monitoring your blood pressure and pulse every 15 minutes.
What about the heparin? Does anyone have an adverse?
We have not seen any adverse effect to heparin. And whenever some allergy comes out, I would think it's more the toxins than the heparin. And even heparins, people who have got valve replacement who are on warfarin, we don't give them heparin. Or people with aspirin, also we cut down the dosage of heparin.